A shortage of anesthesiologists is now affecting nearly every surgical procedure in this country. Hospitals across Canada are scrambling to hire more staff. The shortages have been happening for years, but it got worse, as we know, during the pandemic, and now it's having a bigger impact on patient care. Joining us from Mississauga is anesthesiologist Dr. Monica Olson. Doctor, good to have you on.
Good morning, Lindsey.
Obviously, the shortage is having a dramatic effect on operating rooms in hospitals across Canada. What has been your experience?
So we know from surveys and personal experience that operating room closures are starting to happen. We know that it's been challenging to upscale or increase the amount of work done to deal with shortages and wait times because there simply aren't enough people. We also know that there's been some values have been reprioritized for many healthcare workers following the pandemic, and that people are choosing to work less, retire early, or retire partially. And so departments across the country, and certainly in Ontario, are dealing with shortages in both in terms of numbers and full-time equivalents, and people are trying to hire. And we know that those issues are more serious and more advanced in rural and remote communities where we see some overlap for our family practice anesthetists with the primary care crisis.
How's this affecting patients?
Well, it's affecting them greatly. So wait times were an issue prior to the pandemic, but as you know, in some provinces and areas, surgical backlogs have really increased that issue. So when patients do come for their surgical or diagnostic invasive procedure, we know that they've waited longer, and in some cases their surgical problem or surgical disease is more advanced. We know that they have at times experience more prolonged pain, loss of productivity, reduced activity levels, and reduced quality of life. And in many cases, they have suffered while they wait. So when they do finally receive their operation, those surgeries can be more difficult or take longer, and recovery times are often longer, both in hospital and at home.
Major impacts on everybody, really. For every 100,000 people, Canada has about 12 anesthesiologists. That is lower than the US, lower than the UK, lower than Australia. How has your life been affected by this shortage?
Well, I'll speak for many of us in saying that we have faced a tremendous workload during the pandemic, and that came on top of a workload that was fairly substantial prior. So many people are feeling somewhat tired, lacking in adequate rest and recovery, and we know that it's vital we remain committed to our patients and patient care, and we think some of these challenges, many of these challenges, should galvanize both us as physicians and our system partners to find solutions, because where there's this perfect storm, there are great opportunities to work for a different future.
What solutions would you be looking at? What would you recommend?
There's really a basket of solutions for this problem. Our problem of staffing shortages has been cyclical. It's happened before. And one of the things that we know needs to happen is a long-term commitment to addressing data collection and analysis so that we can plan our workforce and understand population and patient needs, both in the here and now, but in the future. And solutions need to be both short-term, and we look in Ontario at the creation of anesthesia care teams from the last anesthesia staffing crisis in the early 2000s as a shorter-term solution, but we also need to increase medical student and particularly resident-funded residency training program positions. We need to increase some of the flexibility with which we license physicians, both within provinces and between hospitals and across the country. And we need to find creative efficiency solutions that sometimes local hospitals and groups are capable of doing. And we need to do that with together with our government as central experts to work towards solutions.
Dr. Monica Olson, we appreciate your time. Thank you.
Yep, thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.